one of the things that I thought was a real strength of the conference is the opportunity to work with so many different groups. So you've heard a little bit about how that conference was organized, and it meant that each week we had these different groups coming in to talk about questions that were meant to be focused in a particular domain. So Sarah and I were in charge of interventions, thinking about different correction strategies that could be employed to dealing with the infodemic for COVID-19 especially, but also laying a groundwork for any future health crises where we would need this kind of rigorous intervention. And so what was really exciting was that each group was focused on our conversation, but it was also a continuation of the conversations the groups had been having because they were working together throughout these different sprints. So we would get to enter into a conversation among a group of researchers and try and shift it a little bit to be talking about intervention specifically, but also really gleaning from their insights. And so even though it was the same topic, the first sprint and the last one looked really different because we would build on what we already knew. We would bring the insights from the previous groups into the last one and help us really refine some of the knowledge that we were already building. So I wanted to highlight a few of the key takeaways from our perspective. I think they will differ a little bit depending on which topic master you speak with. But the biggest ones are first just that interdisciplinarity. You heard from the glossary team. There are so many insights we can borrow from a lot of different fields, health communication, risk communication, actual public health, social network analysis. And so far, we each have our own vocabulary. So encouraging us to find ways to speak to other people in other fields, figuring out where those connections are, where we didn't necessarily see them. And then finally, testing and doing research to see which lessons apply to infodemiology and which don't. Some health recommendations might really translate easily. Some of the terms that we use for epidemics might apply to infodemics. Some won't. So that's an exciting area where we all are committed to doing more research. I would say that a great example of that, and you already heard, is the idea of literacy, which came up in every single sprint that we did. That literacy might be a way to help us build resilience so that people themselves are empowered to recognize what is good information and what is bad information. There's a lot of research on a bunch of different ways of defining literacy, all of which has some promise, but all of which also has a bunch of limitations where they haven't necessarily applied them to this topic. So that's a space where getting all of these people from different fields in the same space really helped build that groundwork that will allow us to test literacy against infodemics. Likewise, thinking about the personas that one of the participants mentioned, thinking about who the vulnerable audiences are and whether we're talking about vulnerability in terms of disease versus in terms of information consumption versus in terms of information spread is going to be really important. The other kind of ways to think about it are in terms of what are the actual interventions that we need. And so we decided that as a team, what we need is a living systematic review, a place where all of us can look and see what is the misinformation that is spreading, what are the characteristics that are going to make misinformation spread particularly problematic, and then what are the interventions that we know are likely to be successful against those types of misinformation. Again, there's so much great research being done, even more than I was aware of. And so finding a place where all of us can speak to each other more quickly, more readily, where we're building on each other's work rather than working in silos is, I think, the promise that this conference really represents to all of us. And so I think it was a fantastic experience and one that I hope can continue with the foundation that we've laid in the past 2 weeks to inform all of our decisions and reinforce the connections that we made over the past few weeks.
Thank you very much.